Okay.
Okay, thank you and welcome. Good afternoon. This is the regularly agendized meeting for Thursday, June 26, 2025 of Northern Nevada
Recording
Public
in
Health.
progress.
I'll call it to order now and ask for Madam Clerk for a roll call and determination of quorum.
Chair Reese,
Here.
Vice Chair Andriella is absent. Board Member Anderson,
Here.
Board Member Brown is absent. Dr. Danko is not present. Board Member Driscoll.
Here.
And Dr. Duarte.
Here.
We have a quorum.
Thank you so much, Madam Clerk. And now for the Pledge of Allegiance, I'll ask my colleague from Sparks, Commissioner Anderson, to lead us.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited.
Thank you, Madam Clerk. Do we have public comment today?
We do have one public comment.
Hi there, this is Molly Rose Lewis in Senator Jackie Rosen's office. I am just calling in to say hello and remind y'all that we are here and available to help with anything federal related. Please definitely keep us posted about any specific funding issues or assistance in terms of letters of support for grants and anything we can do to help with individuals having any issues with things like Medicare or anything else in the DHHS related field or anything else. So just letting you know I'm here. I will listen to as much of the meeting as I can, and please always contact me if we can help you. Thank you.
Molly Rose, thank you so much for being here and give our regards to the Senator.
We have no further requests for public comment.
Okay, thank you, Madam Clerk. We'll close item number 3 and move to item 4. Let me ask Dr. Kingsley, are there any annotations
Hold
to
on.
the...
We did get another request.
Oh, perfect.
Sorry.
Love that.
Darcy Phillips.
Darcy.
Can you hear me okay?
You can. Thank you and welcome. How are you, my friend?
I'm doing well, thank you. I'm traveling. I'm in a car on a phone, so I apologize. But I'm the executive director of Keep Trucking Meadows Beautiful. I wanted to say 2 things. Thanks to our partners, Gear Hut, who are being recognized today. But I also really wanted to thank Northern Nevada Public Health, and especially David Kelly, for being so supportive of KTMB's work and all the cleanups and the illegal dumping and all of that. And we are super excited to hear Sophie's presentation, our AmeriCorps today. She's headed off, if she doesn't tell you, to graduate school for public health in Washington. So we are super excited to hear her presentation about vapes today. And thank you all for all you do. I appreciate it.
Darcy, thank you. Always a privilege. Safe travels.
Thank you.
Okay, there is no further public comment.
Okay, Madam Clerk, thank you so much. That'll close item 3. We'll now move to item 4, which is the approval of the agenda. Dr. Kingsley, are there any changes to the agenda that was posted?
None noted at this time.
Okay, I'll look for a motion, please.
Mr. Chair, motion to approve the agenda.
Okay, I have a motion by Mr. Driscoll.
Second.
Second by Mr. Anderson. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Madam Clerk, I just want to make sure, if you could please record your votes in our electronic system as well. Okay, that'll close out item 4. Item 5 is recognitions. Dr. Kingsley, I'll turn that over to you.
Thank you. Good morning. We're first going to begin with new hires and ask Dr. Dow to come up and present.
Good afternoon. For the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. I'm super pleased right now to introduce to you Mr. Kasimu Muhatir, who just joined us this month as the new Statistics and Informatics Supervisor here in the EPHP Division. Mr. Muhatir holds an extensive background in surveillance, statistics, and informatics. He has spent 6 years at the Houston Health Department, first starting out as an epidemiologist and later advancing to the epidemiologist supervisor. He then served for about 3 years with the Harris County Public Health Services as their epidemiology informatics and reporting units manager. And also prior to joining NMPH, he served as a statistician for 5 years at the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Administration. He also holds a decade of work experience in HIV surveillance and treatment. Mr. Muhatir has a degree in preventative medicine from Shanghai Medical University School of Public Health and also holds a Master of Public Health degree from the Tulane University School of Public Health and Tropical Medicine. So in his free time, he loves spending time with his twin boys and enjoys playing tennis and poker with friends. I'm super pleased to have him here leading our statistic informatic efforts, and welcome.
Mr. Muhatir, welcome. We're glad to have you.
Thank you.
Thank you, Dr. Dow. We'll next move on to years of service presented by Deputy District Health Officer Erin Dixon.
Good afternoon. We have 2 years of service to recognize. First one is Miss Lisa Lotritz. As we all know that she is on her retirement. She officially hit 30 years. And her official retirement date off the books will be July 8th. And then for 20 years, we have Maria Guadalupe Mendoza. She has been with the WIC office for 20 years, serving our clients very effectively at the front desk, and very grateful for her service. And then I'm going to go into Washoe Stars. So while NNPH has Health Heroes, Washoe County has something called Washoe Stars, which is very similar. And sometimes our staff is also recognized by Washoe Stars, since we like to honor them here as well. So for quality public service, we have Ann Stoll-Trulock. She is with Administrative Health Services. And then we have Stacy Dozier for effective communication, also with Administrative Health Services. We thank them for their service and their great work.
Great. Thank you very much. And then move on to Health Heroes presented by Frenchie Rubio.
Hi, Frenchie Rubio from Environmental Health Services. So for the month of May 2025, the Health Heroes Committee recognized Gia Bethia from EHS for the value of collaboration, Kaylee Barron, Kalisa Sharani, both from CCHS, Tyler Henderson, Luke Franklin, and Josh Foster from EHS. They were all known for the values of collaboration and compassion. And then we have Megan Rennie, Candace Brown from AQM, Dawn Edwards, and Lauren Huntsman from CCHS, all known for the values of collaboration and compassion.
Great.
Thank you.
Great. And thank you. Thank you, Frenchie, and also as well for our staff and their exemplary service. And that concludes that.
Thank you, Dr. Kingsley. Item 5 will close out and move on to item 6. Item 6 is a consent agenda, and items on this can be pulled by any member. Do any member wish to have an item removed from the consent agenda as posted? I don't see any, so I'll look for a motion.
Move to approve.
Okay. I have a motion by Mr. Anderson, a second by Mr. Driscoll. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion carries unanimously. That brings us to item 7. Item 7 is a presentation and recognition of Gear Hut for their Green Biz Award. Welcome. Staff presentation by Mr. Kelly. Thank you for being here.
Okay, fun stuff time. For the record, my name is David Kelly. I'm a supervisor with Environmental Health Services, and today I feel very fortunate to be able to bring to you some recognition, some great collaborators in our community. You heard a little intro from Darcy Phillips, and hopefully I have a presentation and my clicker. All right. So first, a little bit of background. By state law, in NPH and EHS in particular, we act as a solid waste management authority. We engage in a variety of regulatory activities with waste streams in the community. And as part of that, we also contract with Keep Truckee Meadows Beautiful to do a variety of things. Most everyone is familiar with their large cleanups. And another aspect of their contract is they also conduct outreach and education and work with companies in the community on their environmentally sustainable practices. So that's what we get to talk about today. The program is voluntary, and we've only done this twice. The first time was in 2022. It was supposed to start, and then COVID hit, and then we had one, and it's been some hiccups, but hopefully we're going to have a lot more of these in the future. The Green Business Program basically recognizes businesses for their practices. There are 3 different certification levels. Leader would just be that they have sustainable activities. Champion. So each one is as they get deeper involved with either their waste streams or how they engage with the community. In this case, we get to recognize the top tier. So, Gear Hut, I'm hoping you are all familiar, and if you're not, you should be. It's a used gear and consignment store down south of town. It's a great store. This is Leah Zintek. Yep. Sorry. Yep. Her husband, Rusty, and daughter are not here today, but we appreciate you coming in. I did want to point out, again, the hiccups. May 2023 is actually when Gear Hut received this recognition, and unfortunately we're just bringing it to you now, but it's important that we recognize these people in our community. So their company is pretty straightforward, but I think their engagement in the community is much larger, and that's what brought us here. So, so I'll let some of these bullet points speak for themselves. 95% of the shop waste was diverted. You know, they eliminated plastic bags. They used secondhand racks displays. These are all things that if we did more of, we'd have less landfill usage. You know, we'd reduce, reuse, and recycle. We'd engage in that a little bit better. They have a little camper cylinder program for propane cylinders, bear vaults, which not only, if anybody backpacks, a bear vault is a container that helps protect the food so that bears can't get into it. And that actually has larger impacts. As bears get more accustomed to eating human food, they also go into trash cans and trash bins. We have programs in Incline to make sure that people protect against that. So it has a much larger impact than just for us backpackers. And of course, they donate things that are not selling to charities. So a lot of positive impact from that as well. But it's not just their business. There's some nice pictures up there. They've participated in local cleanup efforts, and KTMB also runs an Adopt a Spot program where people and local businesses can come and sort of manage that or spearhead it. Faker Hills Trailhead is Gear Huts. A couple of nice things that they've done, the negotiated recycling services for the landlord for the entire complex. If I remember correctly, this program and going through the process to gain certification was actually useful in negotiating with the landlord and having that conversation about why it was important. And really, recycling for commercial activities is something that we have looked at and explored for a long time. It's a great opportunity. There are some challenges. So it's great to hear that we're getting some progress out there. And of course, encouraging just less air pollution as well. I kind of like the ski trucks program because, again, you're diverting something that either you can't sell or it's not working, and then it's made into furniture. Again, it's keeping it out of the landfill. One of the innovative practices they did is rather than have I don't know, disposable price tags that you that you just print up and put on there and then get tossed out. As they went ahead and they came up with their own innovative way to do it with stickers and reduce even that little bit. And that's the level of detail that they've reached, and they strive. It shows their dedication to and commitment to what they're up to. I think that the point is their entire business is focused not only on being a business, but engaging with the community. And it's not only waste reduction, but exercise and being outdoors and celebrating the community that we live in. And I am not surprised that you were awarded this tier. I hope everybody takes a look if they haven't already been there. But the main thing is I just want to say congratulations, Lee, and thank you. I think we all owe you thanks for the work you do.
Yeah,
so,
thank you guys.
Yeah. If the board has questions or wants to comment, feel free.
Leah, I'd love to have you say a few words. Thank you so much for being here. Obviously, you are an innovator, and we thank you for it. Love to see all the pictures of you and your family. That's pretty exciting, too. Let us know how we can help you.
Yeah, KTMB has been invaluable. I think that 90% of our community outreach sustainability efforts have been all due to their offerings, like the Adopt a Spot, which we do cleanups monthly at Huffaker Hills, and then we do a giant trail series. We had almost, I think, over 300 people turn out over 4 weeks for that event, all because KTMB provides the opportunity for businesses to get engaged and involved. So continuing to support programs like them is valuable because it's all circular in terms of the community. If we all rely on each other's resources, it builds a stronger community.
Fantastic. Thank you so very much. I'll see if any of my colleagues have any comments, but thank you for being here. We're excited to have presented you with this award.
Thank you.
Mr. Henderson.
Just want to say thank you for the work you're doing. It's awesome to see how you can make a difference in a community like the business that you're doing. And thank you for the partnership with KTMB as well. Darcy and all the team there, they do amazing work, and I'm fortunate to get to work with them quite often as well. So well done.
Thank you.
Okay, thank you so much.
Yeah.
Appreciate you. That'll close out item 7. We'll now move on to item 8. David, you're going to kick it off, and then Sophia, you're going to take it over?
Yep,
Great.
you don't have to listen to me very long at this time.
We enjoy listening to you. Thanks,
But
David.
once again, for the record, my name's Dave Kelly. I'm a supervisor of Environmental Health Services. I'm not going to take a long time. I do want to point out that this is the second presentation that involves KTMB. It's a very important collaboration that I think NPH has. So I am pleased to introduce you to Sophie Morton. She has served as the Service Learning Coordinator at KTMB for the past 2 years and is an AmeriCorps service member. She attended McQueen High School and graduated from UNR with a bachelor's degree in environmental science. Working at KTMB, she works to educate community members about environmental issues we face here in Northern Nevada. And side note, has a collection of amazing finds from cleanups. I saw them myself, including machetes, animal bones, and rubber ducks. So, as part of her job, we also do some research. We work with KTMB to do research, and she landed the assignment of this vaping research project because there are impacts to the environment from those products. And I don't want to say any more. I'm going to turn it over to Sophie and let her present her work.
Sophia, welcome, and Lancer Pride. Go Lancers.
Yes, I believe I went to school with your daughters. Oh, what wonderful people.
Yep, a bunch of them are there.
All right, well, hello and good afternoon. My name is Sophie Morton. I'm an AmeriCorps service member to a nonprofit organization here in Washoe County called Keep Truckee Meadows Beautiful. I will be discussing the environmental impacts of electronic cigarettes and the barriers for proper disposal here in Washoe County. I aim to share this research with you all today to hopefully shed some light on this issue from an environmental standpoint. And of course, this research has been in conjunction with Northern Nevada Public Health. But since their introduction to U.S. markets in 2007, the vaping industry has seen massive growth. In 2016, the U.S. Surgeon General's office issued a warning that vaping among youth had reached epidemic levels. Despite this warning, vaping continues to be one of the most popular forms of nicotine consumption in the United States. According to the CDC, lining up all of the disposable vapes sold in just 1 year in the US would stretch for over 7,000 miles. This means in the US, we're throwing away approximately 4.5 vapes per second. We can see clearly that this industry leaves a large footprint behind. So my research, again, in conjunction with Northern Nevada Public Health, sought to answer the following questions. How should these devices be discarded? How does their disposal impact the environment? And what disposal options are available to community members? To first address these questions, I needed to understand the various components these devices are made from. Most e-cigarettes on the market are made from 4 common components, starting from the left-hand side: a nicotine-filled cartridge, a heating element, a power source, and all wrapped together in that little plastic shell. The 2 components that we'll focus on today are the power source and the cartridge. Starting with that power source, again, that middle left position, that's the lithium-ion battery, and that's what vapes use as their power source. These batteries are small, lightweight, rechargeable, and they're very, very popular and used in many different electronic devices. And then on the far right, you have that nicotine cartridge. This cartridge holds a liquid solution that contains varying amounts of nicotine, flavorings, and common food additives. So the problem is not just that we are using and discarding too many of these devices, but also the fact that we are currently discarding them in a way that is negatively impacting our environment. Electronic cigarettes should never be disposed of in the trash can or recycling bins because they are considered to be hazardous waste. So starting with that nicotine cartridge, even if the cartridge has been completely emptied by the user, trace amounts of chemicals will remain inside, including nicotine. Since 1980, the EPA has listed nicotine as an acute hazardous waste because it poses a substantial and immediate threat to human health and the environment when improperly managed. Coming into contact with this concentrated nicotine solution is extremely dangerous. If these items are added into our regular waste stream, this puts sanitation workers at risk of encountering leaking or broken cartridges. And then secondly, moving on to the lithium-ion battery, these batteries, when they're punctured or damaged in any way, they overheat. This overheating can lead to fires or even cause small explosions. Because of their fragility, they do not belong in dump trucks, recycling facilities, or the landfill where they would likely get crushed. When these devices end up in our waste stream, it puts millions of dollars of infrastructure and hundreds of sanitation workers' safety at risk of literally going up in flames. Unfortunately, this exact scenario has happened all over the country, ranging from small, quickly extinguished sparks to massive facility-leveling fires. The increased risk of catastrophic loss due to fire has driven up the cost to insure these facilities, which will ultimately lead to higher rates for municipalities and residents as those costs get passed on. Unfortunately, this is already happening in our own community. Just last month, I believe on May 29th, a WM truck caught fire in Reno, and I do want to state, although the cause of this fire has not been determined, this is exactly what happens when these batteries end up in our waste stream. So these consequences underlie the importance of access to proper disposal for items that contain lithium-ion batteries, including electronic cigarettes. Especially since lithium-ion batteries will not be going away anytime soon, we must learn how to properly dispose of these items as a community. And again, both of these components in the vape device, the nicotine cartridge and the lithium-ion battery, are categorized as hazardous waste under the Resource Conservation and Recovery Act, or RCRA, because of their toxicity and reactivity, respectively. This means that the collection, transportation, storage, and disposal of these items is mandated by the EPA. However, these rules do not extend to households, meaning it's not illegal for U.S. residents to throw e-cigarettes in the garbage at home. Although we know that that does happen, with the rise in products that are literally marketed as disposable, there is a huge misconception that they can and should be thrown away after their use. A study, which you see on the board, was conducted by Truth Initiative in 2020. They found that almost half of young people don't know what to do with used e-cigarette pods and disposable devices, which led them to be disposed of in the trash, in the recycling, and even littered on the ground. The survey again illustrates the importance of spreading awareness that e-cigarettes should be disposed of with other types of hazardous waste. My position at KTMB allows me to see this disconnect firsthand. These are all photos that I have taken during cleanups hosted by Keep Truckee Meadows Beautiful, where I have found disposable vaping devices. Unfortunately, this is only a handful of examples, but we have found these devices all over Washoe County on the sides of roads, in illegal dump sites, in parks and open spaces, and along the banks of the Truckee River. Because of the lack of infrastructure for these types of products, they are often disposed of in ways that have negative impacts on our environment. E-cigarette waste is a serious environmental threat since these devices introduce plastic, nicotine, heavy metals, lead, mercury, and those flammable lithium-ion batteries into our water, soil, and airways. Again, going back to that nicotine cartridge, if the liquid inside of this cartridge leaches into the soil or water, it could lead to the swift death of surrounding plants and wildlife. Both nicotine salts and freebase nicotine, which is the type of nicotine used in these vaping devices, both of these types of nicotine are directly poisonous to fish and other aquatic wildlife and organisms, impacting their behavior, physiology, and reproduction even at low concentrations. This concentrated nicotine solution is soluble and volatile in water, meaning that it's easily transported through our waterways, but will not easily evaporate into the atmosphere. So this essentially means that this type of contaminant will stay in our environment for a very long time, which is extremely important to note given our unique location in the United States. Most watersheds in the United States drain into either the Atlantic Ocean, the Pacific Ocean, or the Gulf of Mexico. However, the Great Basin makes up just 5% of the United States that drains internally. This means that our local watershed retains all the water that is precipitated within its boundary, as it does not connect or flow into an ocean or sea. This makes basin watersheds much more sensitive to environmental pollutants as they will accumulate over time. Therefore, the more e-cigarettes are discarded improperly, the more our watershed is contaminated with acute hazardous waste. Again, jumping back to the lithium-ion battery, the fires that are caused by these lithium-ion batteries can be catastrophic, resulting in massive emissions of carbon dioxide. The incorrect disposal of these devices poses an increased risk of wildfires, especially when disposed of in our arid desert environment. We have found several of these disposable e-cigarettes in illegal dump sites in Washoe County. During fire season, all that is needed is a little spark to start massive and devastating fires. And unfortunately, these devices and these batteries provide that spark. Furthermore, the mining of lithium for these batteries has significant environmental and social impacts. Although this topic is a contentious issue, to say the least, one aspect remained clear to me when I was conducting this research. These lithium-ion batteries can be recycled and remanufactured to go back into new battery production. We should absolutely not be throwing any lithium away, even in very small amounts, like in one vape battery. I did a little calculation because most of these devices do end up in the trash, and this means that in the US, we're potentially sending up to 7,500 pounds of lithium to the landfill every single month. This is far from sustainable. To decrease the environmental impact of improperly disposed vapes, there needs to be an increase in the community's access to proper disposal methods. It is important for government municipalities to provide residents with the resources, tools, and services to properly dispose of these items on a regular basis. These initiatives can help reduce the prevalence of illegal dumping and issues that arise from improper disposal. And the great news is that Washoe County and the city of Reno have programs in place to help capture household hazardous waste. To host these programs, municipalities work with the following local companies to discard hazardous waste in accordance with the EPA: Graymar Environmental, Hero Environmental Services, and Redwood Materials. However, many vape users don't realize they are improperly disposing of these products. This calls for a public awareness campaign on correct disposal methods and upcoming disposal opportunities for electronic cigarettes. Local municipalities should also take the opportunity to share more information on the environmental impacts that can occur from improper disposal. Additional proposals for Washoe County are outlined in the final report, which can be found on KTMB's website. So again, I want to thank you all so much here today, and big shout out to Dave Kelly. I would love to answer any questions that the board may have about my research.
Well, thank you so much for the incredible presentation. I didn't hear where you were headed off to school next year.
I am headed to University of Washington to get my Master of Public Health in Environmental Health Sciences.
Well, I hope you'll be coming back here after that, but
I
that
hope
sounds
so, too.
exciting. Thank you again so much for the presentation. I'm going to start with my board members, and then I have some questions for you, but let's start here. Any questions for the board? Mr. Driscoll.
Thank you. Since disposal is such a big issue, are there programs trying to be ramped up where people could, at their homes or in public, have an alternative disposal receptacle to get rid of those units?
Yeah, that's a great question. Because there is a lot of household hazardous waste that we produce, so almost having that third or fourth bin would be helpful. You know, there's paint, light bulbs, and vapes fit into that hazardous waste category. I will say that the programs that are being provided, I think, across the country have really expanded, especially since this issue has gotten national attention, and the damage to infrastructure leads municipalities to provide those types of services to their residents. But as of right now, there aren't really those like home disposal. You really have to get out of your house. A lot of the services that Washoe County will provide are those the community cleanups that the city of Reno will provide. You have to drive up. It's usually at a local high school or middle school. You wait in your car for a couple hours, and you're only able to get rid of a certain amount of hazardous waste. So there are some limitations on the programs that we're able to provide, but I do see great progress being made.
Thank you.
Yeah.
Well, again, I think all of us are very interested in the topic and quite frankly, probably not as familiar with vaping. It seems a newer thing. I certainly don't know folks who vape, but I have always been curious because, like you said, we've had these community cleanups through the city of Reno for the last couple of years, and we've just concluded our spring cleanups. The amount of material that's been diverted from landfills and being left in our deserts has been incredible. Those folks that you mentioned there, Redwood Materials and Hero, we've worked with specifically. The folks at Hero are incredible and do a really good job. For my part, I think, number one, there'll be some discussion that I'll have with this board and the body about the importance of these type of collection and disposal opportunities that we may be able to do as a health district. Northern Iowa Public Health is, of course, very pressed with our budget, and so it's often that's what happens is you meet the reality that we all want to have these cleanups, but our budgets are pretty inflexible currently. And then the second thing is that I see the point that you've made about its disposal in and how it makes potentially into our waterways, into our other systems, and so that is very concerning to me. You showed one picture that I was curious about, and yes, that was it. No, that one. So it's like a Sharps box, right?
Yes.
It kind of reminds me of that. Is that a proper way to dispose of vapes? Like if I were a person who vaped, and I am not, but if I were, would I want one of these in my home and I just pop the things in there and then eventually I'm going to take them to Hero or someone else using this concept?
I definitely think that the survey conducted by Truth Initiative showed that a lot of vapors, a lot of young adults will collect them. So I do think it's a good idea to collect your vapes inside of a container that you know contains hazardous waste. Also something that will contain that liquid nicotine that's in the cartridge, just because it can be poisonous. It can be absorbed through your skin. So just to prevent that from leaking in your room or your household, I think is a good idea. But as long as it makes it to one of these companies, that's the only way that it'll be truly disposed of. In fact, even the disposal process through these EPA mandated hazardous waste facilities. I believe what they do with the vapes is they send them to one facility in Arkansas and they're incinerated. Which we could go on about the environmental impact of that process, but I think vapes just altogether are kind of a product that have seen massive growth, but there's been very little research done on their end of life and disposal, and there's still a lot of open questions about that, and even the disposal is creating a huge environmental impact, unfortunately. But yes, I would tell, if I just talked to someone who I knew vaped, if I was talking to one of my friends, I would say collect your vapes throughout the year. If you're a resident of Washoe County, you get one free voucher for household hazardous waste disposal. I think it's usually provided through Graymar Environmental. You make an appointment with Graymar in like your set weeks that you have, and then you go and drop it off, and they will take vapes, and those will be dealt with accordingly. That's what I would tell my friend.
Well, again, thank you for the incredible presentation. You're obviously very passionate about this issue, but also I'm excited to see your skill at public speaking. That always excites me about people who are going into this field. I think that you got me thinking about a lot of things, so I've got to sit with it a little bit. I'm thinking about those canisters that Zen is coming in now, and so I see all these people who are transitioning and trying to get away from smoking into other areas, and then we've got plastic canisters and all this stuff. So it's just kind of a phenomenon that I think we're going to have to be grappling with, and perhaps people are not quite thinking about in the way you have. So for me, it was a very informative presentation. I thank you for it. Thank you so much.
Thank you.
Okay. We'll close out this item then and come back, Mr. Kelly. Thank you so much. Okay, Madam Clerk, where are we? Item 9? Okay, thank you. Mr. Duplantis, welcome. Good afternoon. You don't look like a vapor to me, Mr. Duplantis, so I bet you learned something in that last presentation.
I did. I did not know that there was not a proper easy access place to dispose of these things.
I just figured people were throwing them in their garbage can, and that was where they were going. Now we know it's not where they should be.
Quite the education for all of us, I must say.
Welcome, Mr. Duplantis. Item 9 is yours.
Thank you. Good afternoon, Chairman Reese, members of the board. I'm Barry Duplantis, Chief Executive Officer and President of REMSA Health, for the record. I understand you've been provided with a copy of REMSA Health's May 2025 report. For May and for the fiscal year to date, REMSA Health has exceeded franchise response compliance requirements with priority 1 calls in all franchise zones. Results were 91% in Zone A and 93% in Zones B, C, and D. During the month of May, REMSA responded to 8,505 priority 1 calls, and we transported 5,471 patients to area hospitals, pretty consistent with the prior month. Our average response time was 5 minutes and 47 seconds as compared to the franchise requirement of 8 minutes and 59 seconds. Next, I'd like to say that for the customer survey report for the month of May, the score that we earned was 94.34, which was slightly up from the prior month. Our highest score area, and I'm very proud to talk about this point, and it's our highest score area was, of all responses, was the extent of which medics cared for you as a person. I'm really proud to say that one of the things that our organization does in this community is exhibit sincere and genuine care to all members that we respond to, and that clearly came out in the survey. And then next, the thing I'd like to just kind of comment on, because of the world that we live in today, is every day our news networks tell us about the myriad of uncertainty that we face as citizens, families, and individuals regarding various services that we count on to care for ourselves and our families. I'd like to just simply go on record with this organization and with the community and state very clearly that our EMS services are solid, ready to serve, without any respect to one's ability to pay. All calls come in, 911, how may we help you? It's always focused around our care is always focused around the caller. And so I just know, and I see it every day myself, there's an endless amount of data elements coming to us in the media that make us doubt whether or not we can count on various things. But I just wanted to be clear and go on record that REMSA and our EMS services in this community are here to serve without fail. And that concludes my presentation for today.
Mr. Duplantis, thank you so much, and no doubt they have served us for many years, and we're grateful for it. We look forward to some of the things we got here to discuss in the upcoming months. Thank you for your commitment to our public health, and for that, especially, I'm extending my sincere gratitude to you for it.
Thank you. I'm also available to answer any questions that anyone
Yeah,
may have.
we may have some questions. We often do, so let me turn to my left, and we'll see. We're okay. Okay, and to my right. Mr.
Yes,
Driscoll.
Mr. Chairman.
The
Thank
floor
you.
is yours.
Thank you, Mr. Duplantis. And I want to echo the quality of service that REMSA provides in addition to the first responders that work with them as a team. But with that, I have a question. As you know, in my prior life, I was around when the franchise agreement was renegotiated. And then in my new life here on this board for the last 6 months. And there's a trend that I see in your report, and thank you again, your report's always very informational and provides a lot of information. There's this number that just keeps popping up at me month to month. And you and I discussed this yesterday, or 2 days ago on it, so I'm not surprising you with this question. What I find curious is, over time, we provide a great service to those patients that need it. The agreement mandates that you're there on priority one calls in a time frame depending on zone, and you meet that within 90% of the time is what the agreement agrees to. Your presentations over time have noted that when you're not there on time, that your management team looks at the reasons to determine what's going on, and you're doing that for managerial purposes to provide better service. Where I'm struggling in looking at the data is that it's consistent. It runs between 90 and 91% for Zone A, and runs 92 to 93% in B, C, and D. I would like, with the permission of the chair, a presentation in the future that explains to the board what you see in those reviews, what you're doing, and then why is that not changing the outcome to improve your response time? Because we know that in 2014, we changed the maps to help provide for REMSA to get there quicker and provided for some extended times in the outlying zones. We know that you have a fabulous program that moves your equipment inventory around based on a logarithm that tells you where you should be to help. So I'd just like to understand, and I think the board would like to understand with the permission of the chair, for you to just kind of explain, we know we're getting quality service, but we're still not there. And the reason I'm concerned about it is, in the last 11 months, you've done over 91,000 calls, priority one calls. You're not getting there 10% of the time within your window. So that means in the last 11 months, 9,000 calls have made the first responders have to do more interventions for a longer period of time because you're not there. So that's the one I'm looking at. We provide great service, but we're late enough that it seems like a problem. So just appreciate you to educate us as a board sometime in the future. Thank you.
Okay, be happy to do that, because as we discussed it in our brief conversation, we're working with a franchise agreement That was negotiated years ago, and the requirement, of course, is 90%. I mean, so that is what we're managing towards, to exceed that. But to provide you with an answer with data, I'd be honored to do that. I certainly could do that, at least to help you understand how that metric works and what does it mean.
And from my standpoint, why is it not improving with considering it's getting a lot of management attention? So thank you for that. Second thing, Mr. Chair, if I might.
Of course, Mr. Driscoll.
Also, as I shared with you the other day, being new and back to looking at the reports, one of the things that I was concerned about, and I'm going to ask the health officer to provide me with a private meeting offline to explain his decision-making process on the use of the penalty funds that you charge yourself when you are late. In looking at the franchise agreement in 7.7 of the penalty fund, it talks about defraying costs for education and the community. Without knowing some of the background of the actual what's being purchased and just having the one little liners, I'm going to ask the health officer to educate me in his decision-making process on what he's allowing you to spend that money on. Because just with the titles, some of it to me, because of my previous life and my new life now here, I'm not sure how the expenditures as I see them without more detail meets the language in the franchise agreement. So he will provide me some information, and then I will most likely have a conversation online with you at this dais at some other point in time. But I just wanted to let you know I'm doing that, because you never know, it might affect how you spend your money.
Okay, thank you.
Thank you very much, Mr. Chair. That's all I have.
Mr. Driscoll, thank you so much. And I suppose this conversation highlights the rich diversity of experience that this body has, right? Mr. Driscoll has collectively more experience, I think, than most of us on this board with regard to local government, and that means looking at the details, right? I don't know that Mr. Anderson and I can make the same claim, quite frankly, because as elected officials, we wear a different hat at times. And so, Mr. Driscoll, I think you've really posited two very important ideas, and we'll work with the health officer to find time and space for you to have both the opportunity to make a presentation, which we always welcome and invite, and also perhaps to provide some detail and information that will help us to understand the questions. Because Mr. Driscoll raises important questions. I don't know the answer to it. For example, when he mentioned the 90% range, and you said your response was something along the lines that was the requirement of the franchise. I don't know if that means then that, is there anyone in the country who can claim to make 100% of the response time? I mean, I don't know. Like, is there a national standard? Are we working towards that standard? These are the related questions that come to mind when I think about it, right? 90%, of course, is an A, except for the people who aren't getting the response time that we need that makes it be a much better outcome. So I'll be excited to hear about that. And then certainly, Dr. Kingsley, if you want to jump in on this question about how those funds are spent or what they can be spent on. Again, not necessarily today. It's not the purpose of that. I think Mr. Driscoll is indicating is a desire to see it happen, to give you the time to put together the information that we need. No one expects you to have it off the cuff. So again, thank you, Mr. Driscoll, and we'll work with the health officer to get those items back. Dr. Kingsley, do you have any comments?
Nope. Just want to say thank you. As part of this process, I'm about a year into my tenure here. Just a great opportunity that we review this and be able to historically look at it and put a microscope on it so we can continue forward in this. So thank you.
Thank you.
Okay, any other concerns by the board? Seeing none, I'll close this item, and thank you, Mr. Duplantis, for the presentation. We'll look forward to working with you in the future.
Thank you.
Would
Yes.
you like a motion to accept the report?
Is it for possible action? Let me see. Okay, so I'm looking for a motion for the acceptance of this month's report.
Mr. Chair, I'd like to move to accept the report as presented.
Thank you so much. I have a motion by Mr. Driscoll,
I'll second.
a second by Dr. Duarte. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Anyone, no. Motion carries unanimously. That'll close out item 9. Item 10, this is Mr. Vega. I think your item next. This also is tagged as for possible action. And so thank you so much, Mr. Vega, and welcome. Item 10.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I do have a few slides just to kind of summarize some of the information. I think the majority of the information has been provided in your packet, but I'll go through this pretty quickly. So again, we're discussing here case number 1511 in regards to Saronic Investments and AQMV 250003, 4, 5, 6, and 7. These violations are violations of federal standards, specifically pertaining to the management of asbestos. And on the screen there, you can see that the Air Pollution Control Hearing Board did hear the appeal, and based on their expertise, it is their recommendation to uphold the appeal of AQMV 25-0003, deny the appeal of AQMV 25-004, 5, 6, and 7, and levy a penalty of $95,000. So again, that's pretty much my presentation. Again, I believe the majority of the information is provided in your packet, but I'd be happy to answer any questions.
Okay, Mr. Vega, thank you so much for the presentation, and I'll start. And so ultimately, I was able to review the packet and understand the staff recommendation. One of the things that concerns me is the dollar amount is quite high, and I would anticipate, or I would have anticipated, that were I involved with this particular entity, and I don't know how to pronounce it, Saronic? Saronic. That I might have been here to plead my case or to talk about it. I don't see anyone here. They've not registered. Were they present in any of the process before this? Have they shared correspondence with you? What can you tell us there?
Yeah, excellent question. So we have a very I'm trying to think of a good description here, inclusive process when it comes to identifying violations, and then as we navigate the enforcement process, again, very, very inclusive. So we're in constant communication with the I guess violator is the correct term, but so once the violations are identified, we collect all the information. Once we have all the information collected, we meet with the company and present all that and say, you know, here's what we're seeing. Is there something we're missing? And so even up front, we allow that opportunity to provide information that kind of maybe disagrees with any of the evidence, or if there's a misunderstanding, or you know what, in fact, we did do that test, and here's the evidence. After we provide that opportunity, again, if there's no additional information that the violator can provide, then we move forward with the issuance of the violations, and at that point, they can appeal our decision to the Air Pollution Control Hearing Board. And again, we are very flexible, and we want to make sure that every single opportunity, their voice is heard. So specifically in this case, once we issued the violations, they had 10 days to appeal. We accepted their appeal. From there, it was us working with the violator to hold the hearing at a date and time that was acceptable to them. We actually originally held or scheduled the hearing, and there was a conflict. So we rescheduled the hearing just so they could make sure that they were in person in front of the Air Pollution Control Hearing Board. So again, we meet with them, again, just to discuss all the evidence. Then at the appeal hearing, they're able to provide additional information to the Air Pollution Control Hearing Board. Even after the decision from the Air Pollution Control Hearing Board, we provide notification saying, hey, here is what the Air Pollution Control Hearing Board determined, and here's next steps. So for example, we notified them that, there was no final decision until the District Board of Health had voted on it. So if they would be interested to provide additional information, there was still another opportunity. So you're correct, I'm not hearing or seeing the appellants here, but they were notified that there was still another step in the process.
Well, and I suppose ultimately the question, the reason why I asked the question is because we want to ensure that everyone has due process in this, during the process, right? And so it sounds like you've gone above and beyond. You've followed all the statutory requirements, the noticing requirements as you've identified them, and that there were opportunities for them to present, let's just call it their side of the case. And so I am, I suppose, accepting of the work that you've done. I have no concerns that you have not followed a process that would necessarily lead them to be able to appeal, anything like that. So thank you for explaining it to me. I appreciate that.
Of course.
Let's see if anybody on the board has questions. Mr. Anderson.
Yeah, I don't have a question for you, but I just want to say thank you very much for the great explanation in the report of what took place. Because honestly, being in business, I know how much I need to sell in goods and services to overcome a $95,000 hit, and it's huge. So when I saw that, that was like, whoa, that's a significant amount of money. But I'm so thankful for the process that you go through. And again, I'm amazed by the department as a whole, that education is the first step, that it's not that we want to just go find people and, gotcha. But when something serious takes place and it's not being addressed properly, there has to be teeth to the result. You know what I mean? We can't just let things go. And in my opinion, everything that was presented was significant enough that this was a serious issue that had to be addressed, and likewise, the penalty is appropriate. So I thank you for the explanation in the report. Everything, it was extensive. So thank you for everything you guys have done.
Thank you, Councilman.
Any additional questions, Mr. Driscoll?
Thank you. Mr. Vega, in your report, it was clear that part of the reason we're here and that there's been fines levied is that there was work that was done inappropriately. The controls and the protections were not in place, and that material, which was in fact contaminated based on your reports of your investigation and your testing, made it into the mainstream of the waste system. Were we able to kind of catch that in any way and remediate, or is it just one of those things that it's in the mainstream and you're doing your job to try to not let that happen again?
Yeah, correct. Thank you for the question. Unfortunately, yeah, once it's at the landfill and it's disposed with the rest of, the garbage, there's kind of no going back, unfortunately. So we make a concerted effort to make sure that we do all the outreach and education as far as what the proper disposal mechanisms are. Unfortunately, in this case, they actually did the testing, so they were aware of the contaminated materials. And unfortunately, it's just a very tough lesson to learn for this case.
Thank you.
Okay, are there any, Dr. Kingsley.
Thank you, Director Vega. I just want to, more so for those who are listening as well as our board, just two clarifying points for the record. One, just a brief, quick composition of the Swiss board, just so people understand, what that is really, who they're, as part of that due process, who are these experts in our community. And then two, the fees, where are they designated to go?
Thank you for the questions. So the Air Pollution Control Hearing Board is made of subject matter experts. It's 7 members. 3 of them are dedicated expertise. We have an attorney, we have a licensed contractor, and we have a licensed engineer. And then we have 4 at-large positions as well. And typically we try to get various expertise in those positions as well. For example, we have Ms. Yvonne Downs, who is, again, a HERA certified in the abatement of asbestos. So, again, providing that expertise as far as what that looks like. And then we have a contractor, a developer. I think one of the at-large positions is a employee of Redwood Materials, who we heard from earlier. So, again, they're subject matter experts in their fields, and we absolutely rely on that expertise. The other part, which is where do these penalties go? I always like to highlight the fact that these penalties go to the school district. They do not come to us. We gain no value from our penalties. They go to the school district. Again, our priority is never enforcement. Our priority is always compliance, outreach, and education. But as Councilman Anderson explained, when there is considerable negative public health impact, we do take that seriously and address it seriously as well.
Okay, any other questions? Board members, this item is scheduled to be an action item, and a very specific motion is included in the packet, so I am looking for a motion from the body. I have it up, so I'm going to make the motion. I'll move to uphold the decision of the APCHB to uphold the appeal of NOV number AQMV 25-003 and deny the appeal of AQV 25-04, 05, 06, and 07 associated with case number 1511 issued to Saronic Investments LLC and levy a reduced total administrative penalty in the amount of $95,000.
I'll second that motion.
Yeah, I've made the motion. Mr. Anderson was kind enough to second that motion. Any additional questions from the board? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries unanimously.
Thank you.
Director Vega, thank you so much. We'll close out item 10 and move now on to item 11, also identified as for possible action. Staff presentation by Ben McMullen. Ben, any relationship to Peggy McMullen?
Peggy, I do not know Peggy.
Okay, it's a common last name, but
My two relatives that you might know would be Rob and Pat McMullen. They owned Scotty's Transmission for a long time.
oh, cool.
Yeah. So.
Well,
cool.
welcome, Ben. Thank you so much for being here. Item 11 is yours.
Item 11. All right. Good morning, Chair. It is not morning. Good afternoon, Chair, members of the board. My name is Ben McMullen, Air Quality Specialist, here to present the 2015 to 2024 annual Washoe County Air Quality Trends Report. The U.S. EPA established the National Ambient Air Quality Standards, or the NAAQS, with the creation of the Clean Air Act. Currently, there are 6 criteria pollutants considered harmful for public health under the NAAQS. This includes carbon monoxide, ozone, particulate matter, nitrogen dioxide, sulfur dioxide, and lead. AQMD monitors all of these pollutants, except for lead, every hour of every day in Washoe County. Currently, Washoe County meets or is cleaner than all the NAAQS that are set by the U.S. Environmental Protection Agency. A little background for the Trends Report. The Trends Report is completed annually to fulfill the requirement outlined in AQMD's Quality Assurance Project Plan. The Trends Report details the air quality data captured by AQMD for the pollutants monitored in Washoe County. This data is shown for last year, as well as a trend over the last 10 years. In 2024, AQMD recorded 4 days in the unhealthy for sensitive groups air quality index range. Sensitive groups include children, older adults, people with chronic diseases, and those with higher exposure to air pollution, like those who work outdoors. All USG days recorded in 2024 are attributed to ground level ozone pollution. Ground level ozone forms when oxides of nitrogen and volatile organic compounds combine with heat and sunlight. In summertime, residents can help minimize ozone pollution by combining trips, filling gas tanks at dusk, completing yard work in the early morning or in the evening, limiting engine idling, conserving energy, carpooling, or taking public transportation. The 10-year AQI trend shows a highly variable pattern due to increasing wildfire frequency in the summer. But looking up to 40 years in the past, Reno area has seen significant improvements in air quality. In the early years of AQMD, our greatest concern was smoke from wood-burning devices in the wintertime. Through strict requirements outlined in regulation, Along with strong enforcement of said regulations, AQMD has been able to drastically reduce wintertime particulate pollution. In the winter of 1987 to 1988, Washoe County experienced 87 particulate pollution exceedances of the NAAQS. The last time Washoe County experienced a particulate pollution exceedance in the wintertime was in 2013. Now the greatest challenge to air quality in Washoe County is ground level ozone in the summertime. It's shown here. Washoe County is close to violating the ozone NAAQS. If Washoe County were designated non-attainment by EPA for the ozone NAAQS, restrictions could be placed on local industry, local development, and residents. A study about what ozone non-attainment would cost for Oklahoma City identified nearly $10 billion in direct and indirect costs over a 20-year period. Development in Washoe County must focus on development in the mixed-use core and Tier 1 lands as identified by the Truckee Meadows Regional Planning Agency. Development in these areas can help mitigate ozone pollution by focusing on transit-oriented development, which creates areas where citizens can work, live, and play. Final takeaways. Trends Report is a hugely important document to us that provides valuable insights into air quality successes and concerns in Washoe County. It shows that air quality concerns evolve as time goes on. With changing social and environmental climates, it is important to make data-driven decisions. And with that, that's the last bit of my presentation. Any questions, comments?
Mr. McMullen, thank you so much. I'll see if anyone has questions at this time. Mr. Anderson.
So the data that you mentioned about what city was it that if they were out of containment?
Yeah, that's Oklahoma City in Oklahoma.
Have we ever looked at anything here in Washoe County? If we were to, what would the financial impact be here?
Yeah, we've not. That's something we'd definitely be interested in. If I can plug, I'll plug a little bit. We've been working on some policy recently for supplemental environmental projects using violation funds to give that money to people who may be interested in funding a project like that, interested in funding a study like that. So hopefully it's something that can be done for the area, but we'll see. Yeah.
I think it would make a much bigger impact to our community if we could put those numbers to thought when you're like, wow, this is the potential impact if we don't do the best we can to reduce our levels of emission. So if there's any way that could be done, I think that would be awesome. And then as a side note, this is a small world. Tell your dad hi for me. I haven't seen him since he sold his business. I think you actually used to work with him down there, didn't you, at times in the lube shop?
I did not. That was my cousin. So that was my Uncle Rob and my Aunt Pat. But yeah.
Okay.
Yeah, I'll tell him that you said hi.
All right. Thanks.
Yeah.
That's what happens when you live in northern Nevada as long as we have. Any other questions from the board? Okay, this item is scheduled also for possible action. And what is the action required on this? Acceptance of a report?
That's what's requested, yes.
Okay, thank you so much. I have a motion by Mr. Anderson.
Second.
By Mr. Driscoll. Any additional questions? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Okay, we're on to item 12. Item 12 is a presentation and discussion of NPH's extensively drug-resistant organisms database. Christabel Sotelo Zekinia. Am I pronouncing that even carefully close?
I'll say my name.
Perfect. Thank you. Welcome.
Yeah. Well, good afternoon, board members. My name is Christabel Sotelo Zekinia. I'm an epidemiologist with Northern Nevada Public Health under the EPHP division.
Fantastic.
So I am here to talk about the XDRO, and I know you guys have received regular updates, and I'm excited to delve a little bit more into this. So XDRO stands for Extensively Drug-Resistant Organism, and I've highlighted the letters in red so you guys can see where the acronym comes from. Modeled after the XDRO system developed by the Illinois Department of Public Health, our Washoe County database serves two purposes. The first, it tracks two high-priority pathogens, carbon-penemase-producing organisms, and Candida auris. And I'll talk more about these in the next coming slides. Secondly, it also serves as a surveillance tool to help hospitals determine whether a patient has ever had a drug-resistant infection before. And this is hosted online. Now I'm going to get a little scientific, and my goal for this slide and the next two slides is to really explain why we care about these two organisms, excuse me. And I'll start with carbon-penemase-producing organism, or CPO for short. They're a type of bacteria that have become resistant to carbapenems. Now, these are our last resort antibiotics. These are what doctors reach for when others are failing. So it's highly concerning when we have bacteria that have developed resistance to them. Next, we have Candida auris, or C. auris for short. It's a fungal infection that has become resistant to antifungus. Both are difficult to treat and can spread easily in a healthcare setting. When someone tests positive for a CPO or a C. auris, they can either be considered colonized, which means they have the pathogen on their body without it causing an infection, or clinical, meaning they are experiencing an active infection. When we receive a CPO report, both NNPH and hospital staff respond immediately. More on the NNPH side, we notify hospitals immediately. We begin contact tracing, and we provide education and prevention for the case and any exposed contacts. We also often end up collaborating with the state and CDC partners. Now I want to delve into the data a little bit more. And this is focusing on CPO between 2018 and 2022. The figure on the left looks at national CPO case counts with an overall increasing trend. If you look at 2018 specifically, you can see that it says 0 cases. That's not accurate. That's just when cases became federally reportable. It wasn't until the following year that cases were being reported. Looking on the figure on the right, we have CPO cases for both Nevada and Washoe County, both who were already tracking cases during this time before it was reportable. Looking at Nevada, which is represented in blue, in 2019 we did have an increase in cases, and that's to be expected because that's when reporting was enacted. After that, we do have a downward trend for Nevada. Washoe County, which is represented in orange, had a similar downward trend pattern as well, with consistently smaller numbers compared to the state of Nevada. This indicates that most of the CPO cases that we are seeing at the state is occurring outside of Washoe County. Now to look at C. auris, the figure on the left looks at clinical C. auris cases reported in the US and Nevada between 2019 and 2023. The US, which is represented with the color blue, you can see that cases have been doubling each year for that. While Nevada, which is represented in the light orange, didn't have any cases reported in 2019 or 2020. However, that did quickly change because by the end of 2023, we had nearly 600 new cases reported for that year alone. Washoe County, we don't have our figures represented up there, and that's just because we had about 5 cases reported during that same time period. Now let's look at the figure on the right. This is a heat map of new clinical cases of C. auris reported in the US. Essentially, the darker the color, the more activity of C. auris is reported for that state. Nevada is the darkest red color possible, indicating that we're a hotspot for C. auris. Our neighbor, California, is also a hotspot. So with our low case counts and us being a hotspot, that reinforces the need for us to be proactive to try to keep our case counts low in Washoe County. Okay, now that I've talked about why we care so much about these two organisms, let's bring it back to the XDRO itself. This is a diagram of how the surveillance system works. CPO and CRS cases are entered into the XERO database, which is receiving live hospital admission data, which is then cross-referenced against the XERO records. If a match is identified, an alert is sent to the hospital and an epidemiologist, myself. After we verify that there is a match here, we implement or help the hospital implement control measures. This is a screenshot of the XERO database. This is what users will see when they log in. It is protected by a multi-factor authentication. Users can sign up to receive 2 types of alerts, text messages and emails. This slide shows an example of each. If you notice, there is no patient information included in the alerts themselves, and that's just to ensure privacy. There is an alert identification number that users can refer to. To actually view patient information, they have to log into the XERO itself. And after successfully logging in, they can use the alert ID to view the possible match. In this sample, this individual tested positive for a CPO, and you can tell that by the boxes in red. If this was a CORS case, then that blue box in the bottom would say yes. So why is the XERO beneficial to hospitals? Well, hospitals don't know that a patient, or they may not always know that a patient has an XERO, a CORS or a CPO. And what the XERO does, it enables them to be able to implement infection control practices that they wouldn't have been able to do otherwise because they weren't aware. So once they receive that alert, they can place that patient on contact precautions, isolate that person from other patients, have staff wear personal protective equipment, and prioritize the cleaning and disinfection of affected rooms. And all of this is done to reduce the spread. In terms of where we are with the current progress, in the surveillance portion, we have successfully integrated 1 hospital so far. They have begun to receive alerts. And then we have 2 others in queue who are ready to onboard. And we are in active communication with 1 more. And what we hope to do in the future on the right is expand it to other health jurisdictions and onboard additional health entities like the skilled nursing facilities. And there's so many people that I would like to thank for making this possible, from hospital partners to my fellow colleagues. But there are a few that I do want to name: Xuan Su, Dale Montgomery, Donald Bailey, and they are with the NNPH Tech Services team. They're the ones that built this system. They're the ones helping onboard our partners, so they deserve all the thanks in the world. And with that, I'm happy to take questions.
Wow, I don't know whether to be scared or excited. Thank you for the presentation, excellent information, not something I was generally aware of, so very interesting. Let me see if any of my colleagues have questions for you. Dr. Duarte, let's start on the far right there.
Question for you. What disinfectants, are there specialized disinfectants that they're using in the hospital for the CRS?
So we always recommend bleach. Bleach is pretty strong, but I know there are specific ones that the CDC recommends, and I can look that up for you and get back to you.
Yeah, it's just not something I've been very familiar with because I'm not in the hospital settings.
Mm-hmm.
But they do have several disinfectant wipes that we use quite extensively through the clinics, and I'm not familiar. I haven't had a chance to look up and see whether or not those are effective against CRS. I know it's very resistant. I know it's a very problematic organism with a lot of morbidity and mortality associated with it, particularly in extremely ill and immunocompromised people. But the question is, do you need, what specialized disinfection procedures are required? And I think that informs about why the database is important, because if you need to use stronger or more specific disinfectant methods for that room, and also to enable staff to wear personal protective equipment and institute contact isolation precautions as well. So thank you.
Yeah, and you can also read the back of the label of the disinfectant wipes to see if it's effective against C. auris, and then just follow the cleaning instructions on there, disinfection instructions.
Mr. Driscoll.
Yes, thank you. With a lot of patients in the area now are on a single database like MyChart. So is this the kind of thing that once you're determined to be susceptible to either one of these two conditions, is that something that then goes on to something like MyChart and actually is a red flag for anybody who's accessing the patient database?
So our XCRO will have people on there for life. It's not something like a patient could access, and only participating hospitals can access their own patient records. They really wouldn't be able to see other sites. But if someone that was seen at a different hospital, Hospital A, then goes to Hospital B with the XCRO, Hospital B would be notified because of the XCRO database. I'm not sure if that answers your question. Hospitals do flag patient charts for about a year for these conditions. We track them lifetime.
Thank you.
Yeah.
Okay, Dr. Kingsley.
Thank you for this presentation. And just for anybody listening, I just wanted to put a statement out like what is in public health is prevention, right? And we wouldn't, this is the difference of a loved one going to for a procedure to a hospital that could be there for 2 days, and then contacting this could change dramatically what is their stay in the hospital, and a recovery that could have been 2 weeks turned into a full year. And so this is always the goal of public health to one, what our epidemiologists who such as Christabel, what they do and how they really truly impact our community on making a difference in our population's health, and what they do by tracking those numbers, doing statistics, doing the informatics, and then doing the intervention and based on an informed decision. And this is really core public health and really what it does and drives our community and how it keeps us healthy and overall for our families, for our individuals, and for our population. So thank you.
Thank you.
Okay, thank you so much for the presentation. We appreciate it.
Thank you, guys.
Okay, that closes out item 12, which was not for action. Item 13, Dr. Kingsley is going to join us down in the well there. Will be a presentation and discussion on Northern Nevada Public Health Strategic Reorganization for alignment.
Thank you. Good morning. We are embarking on a strategic reorganization effective July 1st, 2025 to further align Northern Nevada Public Health with foundational public health services model and to continue to build a sustainable, resilient, and data-driven public health system. So today I'm going to walk you through the key elements of our reorganization plan, the why now and why this matters. To understand why this reorganization is necessary, we have to acknowledge that Northern Nevada Public's health structure was built around legacy programs and categorical funding streams, not around the core capabilities that truly define a modern, effective public health organization. This has created fragmentation and inefficiencies from organizational culture, fiscal challenges, staff capacity, and leadership transitions that limit our ability to respond strategically. Over the last few years, Northern Nevada Public Health has worked to change this, and this is the continued process to ensure alignment. We aim to create a culture of resilience, adaptability, and innovation that aligns with our mission and future needs. A reorganization will align our divisions and teams, will further align our divisions and teams with foundational public health service domains, or FPHS. So the FPHS model provides a nationally recognized framework that defines the core capabilities and essential services every health department should provide to ensure improved health outcomes and quality of life. By aligning our teams with this nationally recognized FPHS framework, it positions our organization to operate more cohesively, protect critical functions, and build a more stable future through intentional alignment with our core responsibilities, which will create a foundation that is resilient in the face of change. The reorganization is not just structural, it's a strategic shift designed to address complex, interconnected challenges that require a coordinated agency-wide response. Historically, some of our teams have operated in silos. By streamlining programs that share similar goals and functions, We reduce duplication and improve coordination. We're investing in cross-cutting resources like integrated data systems and cross-training. These efforts promote collaboration, increase operational efficiency, and help staff build new skills. Additionally, cross-training and role alignment across programs will strengthen workforce agility. This prepares us to better respond to emerging public health threats and shifting community needs. As part of our commitment to continuous improvement, we engaged 360 partners to gather broad feedback across teams and programs. The goal was to understand how we can better support staff, improve systems, and strengthen internal operations. The assessment revealed what many of us already knew about our organization. We heard interest in more advancement opportunities, better coordination across teams, clearer documentation, and a culture that supports innovation and adaptability. These align directly with our strategic plan, and the reorganization addresses these pain points directly. Over time, our organization specifically expanded its capacity to address public health threats, unfunded mandates, and other critical community issues, particularly through growth in our community and clinical services. While many of our programs we offer fill unique gaps that cannot be duplicated elsewhere, we're now focused on thoroughly evaluating how we can continue delivering high-quality services while being forward-thinking and making the most of the resources available. As you can see by the number of overall with FTEs in our division, we have where we have focused at and where we can identify some opportunities. This further is, so these are the number of grants that we have, and just NCCHS is on the right side, and the rest of the health district is on the more colorful slide. So to support this strategic reorganization, we've also refined our leadership structure sorry about that. To provide an idea of what we're currently navigating, a projected budget shortfall in fiscal year 26 and even steeper fiscal cliff in 27, acting now allows us to reshape our organization thoughtfully, protecting core services and avoiding rushed or damaging cuts later on. To support this strategic organization, we've also refined our leadership structure that clarifies reporting lines, centralizes strategic functions under the district health officer, and enhances oversight of our operational divisions under the deputy district health officer. By aligning strategic and operational functions under defined leadership roles, we're creating the conditions for improved coordination, faster decision-making, and increased accountability, maximizing efficiency and impact. And so while we have the restructure, we also do have a rename. So EP, epidemiology, public health preparedness will now become population health, or PHD, population health department. This mirrors many other health departments in the nation, but also helps to better unify our team and provide a clear description of what population health department is taking on within the health district. As we realign our organizational structure, a key outcome is the enhanced ability to maximize our public health impact. This reorganization enables several strategic advantages listed here. The phase timeline for research in this decision was from August 2024 to implementation of July 1st, 2025 to ensure thoughtful planning, inclusive decision-making, continuity of services, and transition planning to minimize disruption and maximize clarity. We're realigning divisions under clearer leadership tiers. This streamlines responsibilities and facilitates better cross-departmental synergy Together, these teams will be better positioned to inform and guide the overall direction of the organization. As well, so now balancing out our workforce, but we're preparing for uncertainty. With grant funding at risk and cost pressures growing, the Foundation of Public Health Services offers a rational and evidence-based guide for what must be protected even in lean times. It enables us to plan for sustainability, not just survival, by making informed decisions about priorities, investments, and disinvestments. So to move forward, we needed an agency-wide culture of collaboration, curiosity, and respect. This reorganization only succeeds if we work as one agency, grounded in a shared purpose, respectful dialogue, and a commitment to solving problems together. It's about building something better, not just different. And so these are the challenges and opportunities that we're navigating. While cost savings are a consideration, this reorganization is ultimately about transformation. It's about building a modern, nimble public health district. And the FPHS framework helps us to ensure that all communities are protected, data informs action, our organization is fully ready regardless of funding shifts. And so overall, we understand that change can be challenging. This is strategic, necessary evolution to ensure Northern Nevada Public Health remains resilient and effective. We welcome your thoughts and questions. Our goal remains the same, a stronger Northern Nevada Public Health that serves our communities with excellence and compassion.
Dr. Kingsley, thank you for the excellent presentation. Let me turn to my board colleagues and see if anyone has questions. Dr. Huarte, we'll start with you.
Dr. Kingsley, compartmentalization of information and siloing of information has been a problem in healthcare for quite a long time. Would you be willing to say a little bit more about how you plan to change that or breaking that down in your organization?
Yeah, so part of it is we'll be moving a component of sexual health, which focuses on epidemiology and points of it, focusing on 4 of our largest in HIV, our sexually transmitted infections, as well as our chronic disease injury prevention program. And we'll be moving those from CCHS over to population health. And so there was that synergy that we would like to create there is that from with our epidemiologists, as well as our informatics, as well as our statisticians, and that available information, it will provide our staff with more clear training as well as synergy between those projects and as increased decision-making abilities. So,
thank you.
Yes.
Mr. Driscoll.
Yes, thank you. Your team's done a tremendous amount of work in their data analysis and their project controls. Just picking something up and moving, it's not a real problem. But in your mind, have you identified maybe a handful of the metrics that you'll use as a dashboard during this transition time and the change so that you'll know that your team is managing to the direction that you're hoping to go based on the metrics?
Yes, so that's our goal, our overall goal to see where the overall effective. We also have to guard some things, I would say, like with sexual health, they have an amazing throughput program on the clinical side that for our individuals that do present with an infection that we maintain that. But overall, yes, we want to see the impact of that. And part of that is with our new informatics as well as statisticians and to measure that. And it's always, did we, evaluate our decision and hope to come back in that time, especially over our next 3 years as part of our strategic plan to demonstrate that. So yes.
Great, thank you.
Okay, Mr. Anderson, any questions? Dr. Kingsley, thank you so much for the presentation. So fortunately, I've been along with you for every step of it, so I sort of understood what was happening. I suppose what I want to make sure I understand is that when you make decisions about organizational structural changes, those really are the decisions that you have to wrestle with, right? I don't know that at the board level, I think that we intend to micromanage the elements of it. I love that you've shared it with us, and certainly I have been kept informed of it at all times for my colleagues' benefit. But remember, we task you with leading the organization, and change is often hard. And so I trust the decisions you've made. I know that, with regard to sort of the specific changes in the area of sexual health, it is your belief that this will decrease the siloing that has perhaps happened in the past and will allow you to have a better integration between informatics, as you said, and those other things. So I thought Dr. Huarte's comment was very, instructive about your goal. Anything else you want us to know as you embark on these particular strategic changes?
No, I just want to first thank staff for, and this is part of the transparency that I encourage, that in bringing this to the board, that yes, a direction internally, but that this is something discussed with leadership and team and really analyzed and researched and as how do we continue to move this forward as part of a strategic plan. So overall, just recognizing that and thanking staff for their patience, for their understanding and their willingness to grow and accept this change and seek solutions for a better organization overall. So thank you.
Outstanding. Thank you so much. Any additional questions or comments from the board? Okay, thank you, Dr. Kingsley. Appreciate the presentation. We'll close out item 13 then. It's not for action. And move now to item 14. Ms. Reed, this is a presentation that you'll be giving, I think. You certainly don't have to come down to the dais, and happy to have the presentation.
Thank you. This is Dana Reed, Deputy District Attorney. It isn't so much a presentation that just my introducing that this board has the opportunity once a year as a board to discuss the interlocal agreement, to recommend changes to as a body and determine whether any revisions or amendments might be desired to the agreement, and then direct staff, if so, direct staff to forward those recommendations to the specific jurisdictions that form essentially are responsible for the ILA that creates the health district, being Reno, Sparks, and Washoe County. The process generally, the only time I've been involved was in 2022, which was the last amendment when the Washoe County Health District became Northern Nevada Public Health. The recommendation was made by the board after discussion to forward the name change to the three jurisdictions. The three jurisdictions had a concurrent meeting where they made the determination that yes, that's the direction they wanted to proceed. The amendment was drafted, ultimately brought back to each jurisdiction for vote and signature, and then that effectuated the amendment. The time period by which any revision, amendment to the interlocal agreement has to be accomplished is before October 1st of this year. It has to be accomplished 90 days before the agreement renews at the first of the year. So that is a relatively short time frame for any big lift. In the alternative, if the board is content with the interlocal agreement as it stands today, it can simply vote to approve the agreement and move forward for another year. And we'll revisit the matter again next summer. So those are your options, and this is your opportunity to talk about anything. I, of course, will answer any question that I can regarding the interlocal agreement. The agreement that you have before you, I think the original interlocal was created in the early 70s. It was revised in 1986, 1993, and then again in 2022. Each of the revisions or amendments were issue-specific. One was when the three jurisdictions delegated their right to franchise ambulance services to the health district. So the health district, as we discussed earlier, is the grants the franchise for ambulance services. Another was when the legislature changed the makeup of the board to include a physician, and then the last was the name change. So there hasn't been a substantive overhaul. Mainly the amendments have been done to address small legislative changes or actions taken by other bodies, essentially. So that is your opportunity. If anybody, one of you would like to discuss the agreement, have suggestions, or want to move forward as we have it, that is within your purview today.
Okay, thank you, Ms. Reed. For my part, I'm not sure that I have any specific things that I want to see changed, and certainly because I wear multiple hats, and one of those is as a member of the Reno City Council, my city manager's office and staff reviews the interlocal agreements with me and on my behalf, and has not suggested to me any changes necessary to meet the needs of the city of Reno. And so I'll turn to my colleague from the city of Sparks and first offer Mr. Anderson to comment if he wishes. One thing I will say is it is I am a little cautious in as much as the good woman from the county, Ms. Andriola, is not here with us today because she's traveling for the National and Nevada League of Cities, I think. And so I would regret passing on the opportunity for her to have any input or commentary. So I may not be seeking a motion for some decision point. It may be that we're looking for a continuance or a tabling of this item at this time. But let me see, Mr. Anderson, you're up first over at the City of Sparks.
And likewise, nothing is coming up from the City of Sparks side that we're concerned with or any changes that we've wanted to make. So we're okay, but yeah, I think it is wise without representation from the county to maybe move this one down the road.
I appreciate that, Mr. Anderson. Any comments from my colleagues? Mr. Driscoll.
Thank you. I guess the question from my standpoint would be, with the reorganization we just talked about, are there any issues or clarifications that the health officer thinks is needed in relationship to putting something in writing with the assistance of the attorney?
Dr. Kingsley, I know that you and I had the same conversation offline, but that they're very different concepts, right? The ILA really governs the desire of the multi-jurisdictional approach to public health, whereas the reorganization really is the purview, I suppose, of the district health officer. But certainly, Dr. Kingsley, do you have any thoughts or comment?
No, just clearly defined as such that those differentiating between two. And so at this time, too, in my review of the ILA, no changes or recommendations at this time from my position.
One of the things I'll tell you also, Mr. Driscoll, because this is of relevance to your experience in local government, is, as a health district and as the Northern Nevada Public Health, one of the things we've been very incredibly able to do in the last, we'll say 2 years, is really lean in with our county partners in this process as we navigate some of the challenges to our financing and how we are funded. And so the ILA does certainly speak to that in many ways. And I think over the coming years, not this year, it will be an important part of this body's undertaking that we work with the county on our funding in a way that meets the goals of the ILA. And so that is one of the things. And of course, if Ms. Andriola were here, she would be able to speak to that and share with you all the work that has been done in a very collaborative manner. And so, again, and of course you know this, Mr. Driscoll, but on all of the interlocal agreements, it really is the question of which of our organizations desire to see change. And I know that at least from the city of Reno, and I think it has been historically the position of the city of Sparks, we don't have the same funding mechanism to support the Northern Nevada Public Health. And so we look to the county to really be a partner in that. And the ILA spells out those commitments. Dr. Duarte, do you have any questions? Thank you so much. I think at this time, then, I'm going to not seek action, and so that means there will be no action on this item, but which would require it then potentially to come back when Ms. Andriola is present. So I won't seek action today, but we'll close out item 14.
Thank you.
Thank you so much. Okay, staff report time, which is always a fun one. We'll turn that over to staff. Item 15 and 15A is Director Vega first. Welcome back.
Thank you, sir. Chair, members of the board, for the record, Francisco Vega, Director of the Air Quality Management Division. I did provide my report in there. I did provide some information on some actions that were taken by Congress to disapprove some waivers to California, and then just provided some information on how that may impact us here locally in Washoe County. Let's see, I'm happy to report that there were no exceedances in May. That's always good news. And then also, as it pertains to building plan review, this month, I'm sorry to report, we were only at 93%. So as opposed to our normal 100%, we'll make sure we get back to 100% in June. And that's it. Happy to answer any questions.
Thank you, Director Vega. I think your staff is doing incredible work. So being down 1 month is nothing to be ashamed of. Any questions from the body? Director Vega, thank you so much. We'll close out item 15A, move to 15B. This is Ms. Shepard's department. a fair Lancer, if ever there one was one.
That's right, Lancer Pride.
Lancer Pride. Welcome, Ms. Shepard. Take it away.
Thank you. Good afternoon, Christina Shepard, Division Director for Community and Clinical Health Services. You have our report on our May activities. Our chronic disease and injury prevention program gave a really nice report on the efforts they're doing around suicide prevention, especially at the legislative level, and then as a community partner with the Washoe County Suicide Prevention Alliance. So I don't have anything else to add, but I'm happy to answer any questions.
Well, thank you for being here, and of course, we're excited about your new role with Northern Nevada Public Health. Certainly, we're all excited to see you flourish there. Tell me a little bit about the reorganization, because you just heard a great presentation about the strategic reorientation, which affects largely you and your colleagues in your department. So how are we doing over there? Where are we at? How are we feeling?
So on the sexual health side, our goal is to maintain the cohesion that we have between our clinic services and our sexual health team, so that we have no disruption to patient services. And I'm very confident that we'll be able to overcome any challenges that come along with that. We've already been in the process of a lot of transition discussions, working out how that referral process is going to look like, and just ensuring that we get clients in as they need to be seen. We are keeping one member of that team, so during that transition, just making sure that she feels like she's really well integrated into her new team and doesn't feel kind of isolated. So getting her trained in our family planning sexual health clinic. Some of the stuff we're just still trying to work out as we work through some funding uncertainties, waiting for some funding to come in to see if, we're gonna have to make some changes to offsite testing, those kinds of things. So we do have some pieces of the puzzle that we're waiting to fall into place before we can make some 100% decisions. But certainly it's not, Nancy and I are working very closely together to make sure that the transition is as easy as possible for the staff and for our community.
Well, I appreciate that, and I'm sure they do as well. I know you and Dr. Dow will work very carefully with one another. I understood, too, that maybe some of the grants that we were worried about the federal government cutting or delaying or reducing, at least in the HIV prevention area, have not been so reduced. And so it must be a very challenging time in your department, because we see a lot of national stuff. I'm not sure it's always connected to what we do here. So I suppose there's some uncertainty in that regard. How are you doing in navigating that?
We're day by day.
Yeah.
Mostly because we are keeping the offsite testing in community and clinical health services. So if we don't get as much HIV funding, or it comes in, reduced or not at all, how can we pivot but still provide those services in the community, because a lot of people have come to rely on that offsite testing in the community. So are there other strategies that we can use to make sure that we're still filling that need in the community in terms of HIV prevention services and offsite testing? We're hoping, we've heard that HIV funding is coming, but we don't have anything specific yet.
Okay. Well, thank you so much for that. Any questions by the body? No? Dr. Duarte.
A question for you, Christina. How are we doing on managing the late-term syphilis and the congenital syphilis? Any ideas about how we're trending with that? I know that we were having an uptick, and we were seeing an uptick nationally. How are we doing here in Washoe County?
We were experiencing an uptick. We, over the past month, have seen a little bit of a decline, but it's really hard, those numbers change all the time, but a little bit of a decline. Our sexual health program supervisor, Jennifer Howell, worked really hard to pass some legislation this past session that requires ERs to do rapid syphilis testing on pregnant people that come through the ER so that they can receive treatment once they get that positive result. We have also implemented rapid syphilis testing in our clinic, so it's a 10-minute test for syphilis, and if they're pregnant and they test positive, we're treating them right away.
Thank you so much.
Mm-hmm. Any other
Okay. Thank you so much, Christina. Great. Thanks for being here. We'll close out item 15B and move on now to 15C, 15 Charlie. I know Mr. Fida is out ill, and so you're back with us. Thank you.
Hello, for the record, my name is David Kelly, Environmental Health Services Supervisor, and I'm standing in for Rob Fida. So you guys have the report. I'm just going to highlight a couple things because sometimes the details get buried in the words and the numbers. May brings in warm weather. A lot of EHS activities ramp up dramatically because of that. Vector surveillance activities start to pick up and complaints from the citizens. We open a huge number of seasonal pools in May. If you look through the numbers, we did almost 250 this month, ramped up a little bit last month at 100, but we do about 60 normally. So those are the impacts on staff. I do want to highlight that program. They introduced a new scheduling system for the seasonal pool operators that's online, and I spoke with several people involved, and I think they like it. We're going to stick with it. It's working for everybody. We also, as weather heats up, waste complaints pick up because neighbors are impacted by things that might be happening next door to them, and we saw that rise. And of course, the special event season gets underway. City of Reno reporting that we're seeing about a 36% increase in special events. So we have a team that's going to be very busy with that, and that will continue through the whole summer. I also wanted to point to the planning in process for the food team, and they're planning a special processes fair. EHS does a lot of outreach with our regulated customers, and this is just another example of how we're trying to adapt. There are more and more things out there in the food safety world that require specialized plans to keep public safe, and they're setting up these outreach events to make sure to assist those customers as they work their way through the process, and I wanted to call that out. You'll hear more once it's completed. I wanted to also remind or re-highlight the two presentations you saw today from KTMB. I'm really proud of the work we do with them. You guys get quarterly updates on the cleanups and the things in the strategic plan, but some of these longer term research projects that we work with them and that lead us to possible questions on disposal or opportunities for new disposal programs in the community and things like that, you don't always get to see them. So I just want to point that out because it's a unique opportunity. And last but certainly not least, I want to recognize that one of our trainees, Julissa Pulido, passed her RHS exam on May 29th, and we're pleased to have her with us and share in her success. If you have any other questions, I'm happy to answer them.
Okay, any questions? Mr. Kelly, thank you so much, and for my part, thank you to your entire team. Pool season is just crazy. And because I've had the unique experience over the last 10 days of being involved in one particular unique and challenging pool, I just know how hard you're all working. So thank you to you, your team, Mr. Fida. I hope he gets better. A lot going on in your department, so thank you for that.
Thank you.
Okay, I'll close out item 15C now and move to 15D. This is Dr. Dow.
Good afternoon. Mr. Chair, members of the board, this is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report, nothing to change or add. Just a quick update in epidemiology. Outbreak numbers have remained relatively stable for the past 3 months. So both May and so far in June right now, we've seen a majority of our outbreaks being gastrointestinal and hand-foot-mouth diseases happening in daycares. This month, in conjunction with National Mosquito Control Awareness Week, the epidemiology program collaborated with our communications team on releasing a reel on June 20th on personal mosquito protection and awareness. That's posted on Facebook pages, Instagram, and YouTube. And in addition to that, an Epi News article was also released the same day covering mosquito-borne diseases, just for public awareness, that outlined evidence-based strategies to mitigate mosquito-borne disease transmission and provided an overview of key mosquito vectors and the pathogens they transmit. So all that's on our website if you're interested to take a look. That's all my update. I'm happy to answer any questions.
Dr. Dow, thank you. As always, I do find the reports very interesting, just from a knowledge standpoint. I also think that the updates that we get kind of throughout the week about different transmission things is always interesting to me. Let me ask a question, though. I have been seeing some national headline news about changes to immunization policy and boards and a lot of things that are way above my pay grade, quite frankly. And ultimately, I suppose I am asking, are we as a community going to be prepared for the upcoming seasons, either flu-related? I suppose I'm not hearing a ton about COVID these days, but perhaps you might say otherwise. What is your sense as a person who works in this area and how we as a community are likely to be impacted in the next several months?
So first thing is COVID, because of the new variants that's been getting a lot of attention, the NB 1.8.1. So far in Washoe County, at least we haven't been seeing any upticks. Our COVID numbers are low, our hospitalizations and death are also low. So that is good news for us right now. We're always vigilant when there is a new variant going around, especially if it could potentially mean some more immune invasive responses that could happen, but right now, because we keep on doing surveillance, we're seeing low numbers. I think the other thing you addressed was probably considering our ACIP changes that's been happening to the board. That is quite of a big change because ACIP recommendations doesn't just affect what the population vaccine requirements could be, but it also affects what our childhood immunization recommendation could be, or healthcare immunization recommendations. That is a big change that we are keeping an eye on. We haven't heard right now what is happening with the next flu seasons, possibly trivalent vaccine, but we will keep you updated when that does come.
Well, thank you for that. And then let me ask you the same question I asked Ms. Shepard about the changes in the reorganization and how that's impacting various of the teams. How are we doing out there?
Our team are obviously trying always to work in synergies, not only within our own divisions, but with other divisions. And there could be a lot of synergy that happens down the road when this change does happen. The name change to population health goes with our overall strategic goal of we're not just doing individual surveillance, we are looking at things on a population level, comparing data from our communities to what's happening on the national level, what's happening on the state level. And the focus on data modernization, focus on our data governance and automation, that's something we definitely want to drive into the programs as these changes happen for our division and with Ms. Shepard's division. As she has mentioned, we're working very closely to make sure this is happening as smooth as possible.
Well, and for example, you introduced a new employee today,
Yes.
and it had some really incredible high-level data analytics knowledge, some concepts that I'm not as familiar with. How does that fit into it?
His background not only is in statistics, but also informatics, and that is a program that we are putting some focus on, just because given the uncertainties when it comes to funding sources, right, our staffing level are not going to be rising as we see possibly in very good years. But also caseloads, diseases, things will continue to happen, and we want to minimize as much human forces for manual work as possible and focus on what we can do to leverage technology for automation, at the same time also leverage what data can speak to community. I think a lot of times what we're seeing, if I'm quoting COVID, what happened when people are nervous is that they are getting misinformation, they're not seeing things in real time, and they want to know public health are making the right decisions, our responses are being able to transmit it to them on a daily basis, and that's what we want to focus on, the data points as well.
Well, what a great answer. Thank you so much for that. Let me see if my colleagues have any questions for you this month, Dr. Dow. Okay. Thank you so much, Dr. Dow. Appreciate you as ever.
Thank you.
We'll close out item 15D and come now, Dr. Kingsley, to you for item 15E as an echo, 15 echo.
Thank you. I have your report before you. Only thing I would add in today is just I want to recognize both the great work being done by our communications team, managing many aspects of our community so that we can listen to them and respond to them, and also the information that we put out through them has been very responsive. So, and then to recognize both the Office of District Health Officer, we actually will be beginning our final portion of for reaccreditation with our FAB certification, our Public Health Advisory Board, and that will take place in July. And we are beginning our community health assessment in conjunction with Renowned, Dr. Dow's team is very much involved with that and setting out our projections. So a lot of work going on between them, and just want to thank the staff for all the effort and time and emphasis that being put into that. But other than that, I have my report before you and open to any questions.
Thank you so much. And Dr. Kingsley, you did hear a request from Mr. Driscoll about a couple of items that he's interested in. And so let's make sure that those make it to our agenda and we discuss when those would be appropriate to come back. Any questions for Dr. Kingsley? Okay, Dr. Kingsley, thank you so much, and glad to have you here today. Okay, that closes out item 15. All the 15E was the last one, and now we'll move last to public comment. Madam Clerk, is there any registered public comment for our last public comment period or any correspondence received?
There is no request for public comment, but I will read the statement. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements, impersonal attacks which antagonize or incite others are examples of speech that may be reasonably limited. There is no public comment requested.
Thank you so much. We'll close item 16 now, and we are adjourned.